high-level commitments can really advance the health and well-being of young people and adolescents. The same for the sexuality education session. What always sticks out for me is the number of young people who are demanding information and knowledge about their health and their rights. And now for a session called Embracing Sexual and Gender Diversity in Sexual and Reproductive Health, LGBTQI+, Adolescents and Young People the Way. And another called Periods Are Bloody Important, Learning from Menstrual Health Interventions. Both of these, as you'll see, lead into the core elements of sexuality education.
Absolutely. And now we have a message from the amazing Eglantina Zing. Now, she is the founder of Go Leodoras. So her story is coming up. And there's also a short skit by a comedian who is huge in Nigeria and beyond. Now, her name is Tauma, and she
Hi everyone, I'm Eglantina Zing here, and I'm super honored to be joining you today at the Global Forum for Adolescents. I want to share with you a little story. Perhaps it's something that inspires you, motivates you, or make you just as me, that I'm just a troublemaker, a trailblazer, a person that is super hard to make her sit down and just watch things happen. I will like change. I'm sure that we can all ask, and our biggest mission in this life is to ask each other, how can we contribute to making this world a better place? So my story goes, I grew up in the Venezuelan Amazon, and my father is an explorer. I have no tattoos, but a bunch of scars from a jaguar, a crocodile, piranhas. And yes, it sounds like magic realism, but it was my reality. In my little camp, there was a soccer ball. My neighbors were persons that did not speak my same language, were not dressed the same way, and we had very different traditions. But through that soccer ball, we forged these really strong bonds of friendship, of collaboration, and solidarity, that until the day I took those with me. At a very young age, that soccer ball taught me that we have much more things in common than what divides us. So I went off years later to the United States and started a career in entertainment, in MTV, Project Runway, and a bunch of other shows that are music and fashion oriented. And yet I was still one of that generation of, well, because you were a woman, you will get to, no, you cannot do that. No, you're a woman, you cannot play soccer. No, you're a woman, you cannot wear a short skirt. No, you're a woman, that's not your role. No, you just go play gymnastics, you just stay at home. Limiting us. There are stereotypes and the societal rules that they don't define us, but they do limit us. And that's why, since I cannot sit around and just watch things happen and conform myself to the status quo, I found the Goleadoras Foundation. With its unique mission is to make this generation of girls the generation of yes. That through sports, a great catalyst to bring us together, to forge character through discipline, through sorority and teamwork, this new generation, they will never get to hear a no because they're women or because they are girls. So I invite you all today and every day to join us at Goleadoras, and as we say there, together we change the game. It's about time. We're in this together. Happy International Girls' Day.
Young people from the marginalized groups and key populations are the most at risk of HIV infection. Now, imagine a world where no one is left behind. U-Tests offer a unique solution to make that exact thing happen.
J'avais peur de fréquenter des centres de santé de mon quartier, de peur de me faire juger ou soit que mes résultats soient divulgués par des personnes qui ont de mauvaises intentions. Et là, par le biais d'un agent communautaire U-Test, il m'a permis de connaître un centre de santé où j'avais la possibilité de me sentir à l'aise, où je ne serais pas jugé.
U-Test leverages mobile technology and artificial intelligence to mobilize young people through social media platforms and link them to geolocalized health services which are friendly to them. Let's support Youth Scale Up now.
“女士们、先生们，大家晚上好！您现在收看的是凡恩安南的首届国际交流线上论坛之青少年健康。很开心能够在我们的直播间与您相遇，不论您此时此刻在世界上的哪一个地方。”
In Geneva, getting your voices heard, and that's so I'm curious.
Hi, I am Simon, courtesy of Youth Partnership for Peace and Development. I am serving as one of the mobilizers for the 1.8 billion Young People for Change campaign. I join hands with Global Forum for Adolescents in making the clarion call for governments and partners to invest into the lives of young people.
Hello everybody, how are you doing? My name is Mrs. Engineer Alaja Professor Doctorate Afonkaduroke. Today I am here to tell you something. First of all, I would like to thank everybody, hundreds and thousands of young people, they're mobilizing to demand for better health and well-being from the. I say thank you very much for the work that you are doing. Now it's remaining if you open your mouth and say something. It's you I come to tell now. You are sitting down there, your mates are there, mobilizing to demand for better health. What are you doing? Go now and go and register for the Global Forum for Adolescents. Follow 1.8 billion and register for it. Only food are not doing anything. Will you go and register?
Muchas cosas han pasado, estamos en decadencia, porque la juventud no hace presencia, porque se ha notado mucho nuestra ausencia, pero gracias a nosotros se acaba la ultraviolencia. Silencio. Ya. El silencio no es algo por lo que podamos optar, por eso tenemos derecho a votar, porque no podemos quedarnos en silencio, ya que las palabras tienen valor y no un precio.
We
Hello, everyone. We are at day 2 of the Global Forum for Adolescents, and I'd like to welcome you all to this session. Periods are bloody important, learnings from menstrual health interventions in school and community settings in low to middle income countries. Thank you all for joining from all around the world, and please stick with us to the end. My name is Liz from Cameroon, and I'm a youth mobilizer and also one of the organizers of the GFA, and I'll be your moderator for this session. Growing up, I was told that periods would start at about 12 years old, but then I had my period at 9, and it wasn't a lovely experience. Everyone at home questioned the life out of me. I was asked every day, Liz, what is wrong with you? Who touched you? What did you do? And all of that went on for like 3 straight days as I bled in my underwear. There was so much shame, confusion, isolation. I felt so dirty. I even thought I would not go to school anymore because I did not want to see people. I felt like I had done something terrible. It did have an impact on myself and understanding of my own body. And I know my story is not an isolated case, and it is exemplary for how millions of girls all over the world experience the start of puberty and how they actually run with it. And so we are here today because we need to raise our voices and say menstrual health and hygiene should not be an afterthought, because it is fundamental to the well-being and empowerment of girls and women. And in this interactive session, we are going to use evidence-based research to highlight strategies to improve menstrual health among young people, reflecting on differences and similarities of the populations, methodologies, experiences, and findings across the different interventions. And also, we will discuss the practical policy implications of enabling menstrual health interventions to be sustainable and scalable to enable girls to thrive. But before we dive in, we want you to share with us your thoughts on menstrual health as a priority to adolescents' health and well-being. There will be a poll that will come across your screens for you to respond. To what extent do you consider menstrual health as a priority to adolescent health and well-being? I am going to give a minute maximum so we can answer the question. To what extent do you consider menstrual health a priority to adolescent health and well-being? To what extent do you consider menstrual health a priority to adolescent health and well-being? Not at all? Are you sure? Do you think it's a lot? Do you think it's somewhat? Let us know. We really do hope you share the same mind with us, and whatever your options are, whatever your mind is on this issue, we hope that by the end of this session, you will be able to change your mind. Oh, wow, we see there are a lot. You actually think this is a lot. And yes, I agree with you. Menstrual health as a priority to adolescent health and well-being, yes, it's a lot. And today we are going to be exploring that. Just before we continue, I'd like you to know that this session was co-created with young people, from the planning to the concept notes and down to designing the presentations. And we have a wonderful panel of 6 brilliant speakers who bring years of practice, planning, and research on the issue, as well as innovative and tested strategies to improve mental health, hygiene, and well-being of adolescents. And so our first speaker, Ms. Chinwe, she's a Deputy Regional Director for UNFPA East and Southern Africa Regional Office, and she brings more than 13 years of global, regional, and national level experience in adaptive program leadership and oversight for evidence-based strategy development, implementation science, and program management. She is going to be talking to us, highlighting the importance of menstrual health and the human rights approach to menstrual health. Over to you, Ms. Chinwe.
Thank you, Mandy. Menstrual health is an enabler for the realization of human rights of all people who menstruate. The onset of puberty and the menstrual cycle is a fundamental and healthy aspect of the lives of women, girls, and other people who menstruate. However, due to social, economic, cultural, or legal factors, they may be subject to discriminatory practices, shame, negative attitudes, and specific prohibitions that often lead to poor menstrual health outcomes and other related human rights violations in all countries without exception. People who menstruate face significant challenges in managing menstruation safely, in a hygienic manner, and with dignity. On the 12th of July 2021, the United Nations Human Rights Council adopted the very first resolution on menstrual hygiene management, human rights, and gender equality. The resolution calls upon states to ensure that women and girls, without exception, have access to appropriate facilities, information, and products for optimal and effective menstrual health hygiene. This is very important. What this means is that women and girls, including those that are vulnerable or in certain locations, have equitable access to affordable, safe, and clean water. This also includes adequate sanitation, hygiene facilities, including a choice of menstrual hygiene products. In UNFPA, we are committed to supporting and working with state and non-state actors alike, duty bearers and right holders, to apply a rights-based, comprehensive, and multi-sectoral response. This approach addresses a complex phenomenon with specific obligations and responsibilities towards ensuring the achievement of the highest attainable standard of menstrual health. We remain committed to ensuring the removal of negative social norms and cultural practices that perpetuate human rights violations related to menstruation. So I join you today to call on all stakeholders to stand with us in our obligation to ensure that menstrual hygiene management, gender equality, and human rights are integrated into policies, programs, and interventions. All of our collective actions will ensure the health and well-being of adolescents, women, and other people who menstruate. Investing in menstrual health can also improve access to quality education, job opportunities, and entrepreneurship. We can tap into the limitless potential of girls, women, and people who menstruate and cascade the benefits to households, communities, and economies. This investment is critical because it also protects the dignity of adolescents and women who constitute about half of any given population. Equally important, it also enables our bodily autonomy and agency, our rights and choices. We cannot do this alone. This requires us to collectively create an enabling environment that will ensure menstrual health justice remains a core component of gender equality. A core component of gender equality. It is my appreciation to be part of this journey in delivering the Africa we want, where female voices are not just heard, but are a part of decision making about our fundamental human rights. Thank you.
Thank you so much, Ms. Chinwe. Thank you so much for that wonderful intervention and setting the tone for this event. Menstrual health is indeed an enabler for the realization of human rights of all people who menstruate. And we also appreciate UNFPA's commitment to supporting and working with state and non-state actors in addressing this issue. Our next speaker we have is Dr. Shakira, who is the thematic lead on bodily autonomy and sexual and reproductive health and rights at UN Women. And she's also a technical specialist at the World Health Organization. She's also a Lancet Commissioner on Adolescent Health and Wellbeing, widely recognized for her work on universal health coverage, gender equality, sexual and reproductive health rights, and youth development. And she is going to be talking to us, highlighting the importance of menstrual health for young people. Over to you, Dr. Shakira. absolutely excited and hyped up to be joining the Global Forum for Adolescence. It's been a couple of months of watching social media buzz, of seeing youth energy, youth perspectives, and now we're seeing 1.8 billion come to life. It's incredible. I really think so. The second reason I'm so excited to check in with you today and during this forum, and specifically this session, is because this session is based on the evidence. Now, for those of us who work in the field, we know that the evidence on menstrual health and menstrual hygiene is quite sparse. In order for us to drive advocacy, to drive policy making, to change legislations on the taxation of menstrual products, for example, we need sound advocacy. Before I jump into a little bit about what the Action Coalition on Bodily Autonomy and SRHR convened by UN Women is about, I wanted to take a step back. And something came to my mind from 20 odd years ago, and it's a personal story. And so I actually grew up in a very disadvantaged background, in a very disadvantaged home. And when my menstruation had commenced, my mom had been great. She went out to the supermarket and she got me a pack of menstrual pads. But that made me think about the fact that it's not also only about the access to menstrual products, but what's the access to the quality menstrual health products? So what's the quality of the products that one has access to? So I don't know all across the world what different brands they are, but essentially this pack that I had wasn't, the expensive brands. It wasn't the Always or the Kotex, for example. It was a cheaper version. And if I recall, I think I went through that pack probably in a few hours because it couldn't hold the menstrual blood. And it was just a really cheap product. I was, however, quite fortunate, which is different to other women and girls across the world, is that my sisters were employed and they would use a portion of their earnings to support me. And what they would do is also purchase menstrual products for me. And so that just got me thinking for this discussion. It's also about the advocacy to the access to quality menstrual products, not just menstrual products. In our Action Coalition on Bodily Autonomy and SRHR, we work on things which are so closely linked and connected to menstrual health, and that includes changing social norms, tackling stigma, reaching women and girls, because we know that it's an issue of gender equality, it's an issue of economic empowerment. We also work on changing legislation. Where it gets really exciting is those commitment makers who are working on menstrual health. And we have the likes of girl-led organizations. We have organizations who are driving innovations like mobile applications on period tracking, for example. And we also have the likes of Wash United, who is spearheading the work on Menstrual Health Day on the 28th of May each year. And their commitment is actually to reach 500 young people all across the world. Their programming is really keen on focusing on supporting youth and building awareness and breaking stigma. But I think what's the most exciting that we're seeing, which is a microcosm of young people's agency, is this on menstrual health. And the reason I say this is whether it's in different gatherings all across the world, or whether it's also been, different consultations we've held, something that's been universal among adolescents, irrespective of where they're from and their different characteristics, is that they have placed menstrual health top of the agenda. That's number one. Number two is that these adolescents are fighting by themselves with almost no resources. And I think that is something for us to harness and to build on. And by this I mean, and I jotted down the names because I don't remember them all, but we have the likes of Maya Abdel Wahab and another colleague, Sore, who worked in the United States. They're aged between 16 and 17 years old. During the COVID pandemic, we saw that girls' school was disrupted. And so the provision of menstrual products was also disrupted in the US. And they eventually got the attention of the senators
to help provide these products during the pandemic. And these are young women, 16 and 17 years old. We have Helena Branco, who's 18 from Brazil, and she caught the attention of legislators dropping the taxation on menstrual products. That's 16, 17, 18 different parts of the world. We see young women being inspired to take up the fight to change things. And they, for example, are based in Indonesia, South Africa. They've started up their own organizations like, and again, I have the name, it's Always Blood Sisters. And I also frequently support and watch the content of organizations like My Period is Awesome. And so, again, menstrual health is top of the agenda of young women. And these young women are mobilizing. They're starting organizations. They're pushing decision makers. They're getting the attention of decision makers. And they're shifting things. And so I think this is a good story for us to tell in our generation. It's also one for us to build on. And 3, it's one for us to support massively. Again, these young women are doing so out of their own accord. Imagine if we were to invest in them, if we were to support them, and if we were to help bring all of these efforts collectively together, we would see, I think, a very different world, and we would be able to build on not just menstrual health, but young people's activism for all parts of health, for all parts of society.
Thank you so much, Dr. Shakira, for sharing your story with us and hitting hard on how menstrual health is not just about period products, but it also cuts across all other sectors, and also calling on stakeholders to mobilize resources for adolescents and all people who menstruate to navigate this experience with ease. I'd just like to say, as the presentations are going on, kindly drop your comments, your questions in the chat, and we would take them up from there. Our next speaker that we have is Ms. Gerda Binder, and she is UNICEF's Senior Advisor for Gender Equality and Digital Technology. She works with teams and partners to harness digital technology for gender equality and close the gender digital divide, especially for girls, to create and benefit from digital opportunities. She is also the initiator and global lead of OKI, UNICEF's Girl Tech flagship on menstrual health and period tracking, a mobile app co-created with and for adolescent girls in low and middle income countries. She is going to be talking to us, giving us an overview of the period application co-creation and highlighting reflections and lived experiences. Over to you, Ms. Gerda.
Welcome to OKI. I'm Gerda from the UNICEF team. I'm happy to be here today and share more about the development of OKI, a mobile menstruation app and period tracker that was created with and for adolescent girls. We started this initiative about 5 years ago because girls all over the world told us they have so many questions about what is happening to their bodies when they start puberty and periods. But menstruation is still such a taboo, and it is difficult for them to find trustworthy, quality information. So we spent months talking to girls. We engaged with more than 400 in Mongolia and Indonesia in a co-creation and design process for a solution that would meet their needs and wants and their realities. And the results were amazing. Girls discussed their barriers to menstruation, to menstrual health information. They shared ideas how to break the taboo, and they crafted mock-ups. Girls informed everything from technical specifications and features to the look and feel. They also chose the name OKI, a fun, made-up word. Girls wanted to make learning about periods and puberty engaging and positive, and ensure that they also reach the most marginalized. As a result, OKI is digitally inclusive, easy to navigate, has tutorials, fully functions offline, takes little storage on devices that girls have access to, accommodates phone sharing, and it has highest data protection and privacy. It is entirely free without ads. In each country, the OKI content and design gets localized by girls and partners to suit their context, languages, and requirements. Local OKI versions are live in 11 countries around the world, and more are coming online soon. Now I invite you to watch a few video clips about Oki and what girls have to say about it. Thank you.
Hi, welcome to Aki, a period tracker app for girls like you. My name is Ari. Use Aki to get to know you by tracking what's going on with your body and mood every month and learn about periods in fun ways. Create an account and choose an Aki friend like me to accompany you. We are here for you every step of the way. This is your monthly menstruation cycle. Each shape is a day of the month. And this number is your personal countdown. It shows how many days until your next period, or how many days left of your current period. Track your mood, period flow, body, and activities with emojis on the daily cards. Write in your private diary card. Test your knowledge and take fun quizzes. Check out your calendar and see your whole month at a glance. And check out the Aki menstruation and puberty information to learn new things about your body and health. And don't forget to send me some love. Welcome, friend, to Aki. For girls, by girls, period.
Hai teman-teman semua.
My experience with the Oki app is interesting, is awesome.
ওকে এর মধ্যে একটা বোতল আছে ডল, ওটা আমার খুব ভালো লেগেছে।
The app, it helps you in recording in your menses.
আমি আজকে একটি অ্যাপ সম্পর্কে জানতে পেরে
Positive, I have loved it.
Mazuri karibia kuanza. Nilipata kuja kwa leo.
sidhani shoga yangu, maana hata shuleni hakuwepo leo. Si unajua ndo tarehe zake.
Jennifer, umekuja?
Wow, nilijua hutakuja leo kwa sababu ya period, kumbe nilikosea.
Wewe, tulia niwape mchongo mzima kuhusu application ya binti kutoka kwa binti.
Ni kweli nilipoamka asubuhi tumbo la period litaka kuharibu kila kitu, lakini nikaigundua application ya Oki ambayo inawezesha wasichana kama mimi na wewe kuweza kufuatilia maendeleo yetu ya hedhi.
Oki?
Ndio, Oki. Zaidi ya wasichana 300 kama sisi wameshiriki kutoa mawazo katika utengenezaji wa application hii. Imepikwa ikapikika.
Hongereni ya smart zenu.
Haatwi mtu hapa. Usipokuwa na simu yako, gongea kwa mwenzio, maana ndani ya simu moja unaweza kujiunga na akaunti zaidi ya moja. Basi, Oki kanipa ujasiri wa kuamka na kuja mazoezini. Halafu, Oki app ni bure. Na ukishajisajili, unaweza kutumia application hii bila hata kuwa na bando la internet. Chezea app inayoburudisha, elimisha na kuchemsha ubongo. Tusichelewe basi besti zangu. Tujisajili leo kwenye hii program fire kwa kwenda kwenye tovuti www.oki.co.tz au tafuta Oki app kwenye App Store au Play Store. Niliwaambiaje? Oki ni ya binti kutoka kwa binti.
Oh, wow, that was amazing. Thank you so much, Ms. Gerda. When I look at that, I just couldn't help telling myself this is what 9-year-old me needed. You know, when I look at the girls in the video and how happy they were to talk about how, you know, they're getting their periods and they have information, I could hear safety in their voices. I could hear, oh, I'm happy to live this experience. And when I think about it, I really did not want to be put in front of my mom, my grandma, my dad, and all of my cousins asking me, what did you do? What is wrong with you? Who touched you? You know? And I think when we say we need all hands on deck, we need all sectors to come on board to ensure that girls experience and navigate this particular issue with joy and safety. This is technology, and it is helping girls to feel safe and have information. I just wanted to have, the app on my tablet, sitting in my room, just scrolling through the questions and finding out what is happening to my body, and not having to, think about isolating myself or getting a drug that will stop the blood forever. And I really think that is something that is, when we say this menstrual health affects the overall well-being of adolescent girls and young women, it is not just about blood in at a specific time of the month. It's about how we see ourselves. It's about how safe we feel. And it's also about how, we're ready to interact with society with what we're going through. Thank you so much, Ms. Gerda. And we appreciate the work you all are doing with Oki. Our next speaker that we have is Mr. Dennis, who is a behavioral social scientist and public health practitioner, focusing on menstrual health, uptake of sexual and reproductive health services among adolescents and young people. He's currently the acting lead, social scientist and project team leader on the Meniscus trial, which seeks to evaluate whether a menstrual health intervention improves educational attainment and reduces mental health symptoms among girls in 60 secondary schools in Uganda. Evidence, people. So he's going to talk to us about giving us an overview of menstrual health interventions, schooling, and mental health symptoms among Ugandan students. That is Meniscus, a school-based cluster randomized trial. Over to you, Mr. Dennis.
Hello, everyone. In my presentation, I'll talk about menstrual health interventions, schooling, and mental health symptoms among Ugandan students, Meniscus, a school-based cluster randomized trial. Meniscus is an ongoing menstrual health project aimed to develop, implement, and now evaluate a multi-component menstrual health intervention in Ugandan secondary schools. It's being conducted in 60 schools with nearly 4,000 girls enrolled. We are also looking at outcomes in boys, and they are key part of the intervention. Nearly 900 boys have been enrolled. Meniscus started in 2015 with a mixed method formative study to understand menstrual health needs of secondary students in Wakiso. Results indicated that menstruation was strongly associated with school attendance, and most girls reported pain, fear of linking blood, and privacy as the main reasons for missing school during their period. The majority of the girls reported being able to afford disposable pads in this peri-urban setting. There was also substantial fear of embarrassment and teasing. So the results from Meniscus 1 informed the development of an intervention, Meniscus 2, which was successfully piloted in 2 schools. And it was found to be acceptable and feasible to deliver, and also potentially effective in improving knowledge and management of menstruation. It also highlighted the need and opportunity to improve schools' ownership of the intervention. So the results for Meniscus 2 showed that a school-based intervention which addresses both the physical and psychosocial barriers to menstrual health has the potential to improve the girls' education and the well-being. So that brings us now to our Meniscus trial, which is a cluster randomized trial to evaluate the impact of Meniscus intervention. So the intervention is implemented by MENA Uganda, a local NGO, and includes 5 components, all overseen by a menstrual health action group, comprised of students, teachers, and parents. So the intervention components include training of teachers to deliver puberty education sessions, supporting school drama clubs to write and perform a skit around menstrual health, then the provision of a menstrual health kit, including reusable pads, access to pain management strategies and analgesics, and also the basic improvements to the school toilet facilities. So that intervention encompasses more than products and information. And this is an effort to create a physical and social environment conducive to improving self-efficacy, learning, and ability to achieve good menstrual health. On my left is a picture of some of the menstrual health action group leaders that have been able to oversee the implementation of the meniscus intervention in schools. And on my right is a picture of a drama skit being performed to the entire school. Before the implementation of the meniscus intervention, we successfully obtained parental consents through school meetings and home visits, and schools that had menstrual health were more willing to participate in the trial. We successfully randomized schools into two arms, the intervention and the control. Then on the randomization ceremony, all schools were present and the control schools offered the intervention at the end of the study. We encountered some challenges, including the COVID-19 pandemic, where all schools were closed until January 2022, and this delayed the implementation of the intervention. So we also had some unsupportive school administrators and teachers, and the teacher turnover, and about 25% of the students left the trial school between the baseline and the inline surveys. We've completed the inline survey, and the team is currently conducting data cleaning and analysis. And the trial results will be available in early 2024, probably January. Finally, I want to thank you to the meniscus trial funders, to the Joint Global Health Trial Scheme, as well as our PI, Professor Helen Wise, and to all of our many team members and collaborators in Uganda and London. Thank you so much. Thank you all.
Thank you so much, Dennis. And in his presentation, we see still that girls were hitting hard on the issue of privacy and right information. Just to say, thank you so much for sharing your ideas and thoughts in the chat. We see you, we hear you. And at the end of the presentations, we are going to have a Q&A with the speaker. So please hang on, stay tuned. We are going to get responses to your questions. The next presentation we're going to be having, it's from Dr. Mandy and Ms. Nomata. Dr. Mandy is a public health specialist and postdoctoral research fellow with a research focus on menstrual health, adolescent sexual and reproductive health service delivery, and public engagement. She's a Reckitt Global Hygiene Institute postdoctoral fellow leading an innovative project that is focusing on women and menstruation across the life course and the co-creation of a menstrual health toolkit with women, healthcare providers, and other relevant stakeholders in rural and urban communities across Zimbabwe. And then Ms. Nomata is a mental health enthusiast and counselor, a development practitioner, and a co-founder of a youth-led organization, Runyararo Peace for Development Program, that focuses on mental health for youth in Zimbabwe. And together they will give us a presentation investigating the acceptability, uptake, and effectiveness of a menstrual health intervention among young women in Zimbabwe. Over to you, Dr. Mandy and Ms. Nomata.
Hello everyone, my name is Mandy Tembo. I am a postdoctoral research fellow with the Health Research Unit Zimbabwe and the London School of Hygiene and Tropical Medicine. And I'll be presenting on a menstrual health study that was conducted in Zimbabwe, and it looked at the acceptability and effectiveness of a menstrual health intervention amongst young women in Zimbabwe. We conducted a cluster randomized trial called CHIEDZA, which stands for Community-Based Interventions to Improve HIV Outcomes in Youth. The trial aimed to investigate the impact of providing an integrated package of HIV and SRH services in a community-based setting to youth on HIV outcomes. We hypothesized that a one-stop shop to deliver integrated services in a non-health facility setting would improve engagement and uptake by young people. CHIEDZA was conducted in 3 provinces of Zimbabwe, with 8 clusters in each province. Clusters were randomized to receiving either the CHIEDZA intervention, which was the intervention arm, or a standard of care that is existing services called the control arm. Services were offered once a week from a community center in the intervention cluster by a multidisciplinary team of Chiedza nurses, community health workers, youth workers, and counselors over 30 months. The package of services we offered included HIV testing, initiation of ART and follow-up treatment, adherence support, including CAPS groups, which were treatment support groups for youth living with HIV. In addition, we also offered contraception, specially designed condoms, management of STIs, general health counseling, and of course, menstrual health. Referral to additional health services were also offered to participants as needed. For the menstrual health study, we provided a choice of menstrual products between reusable pads and the menstrual cup, menstrual health information in the form of a Your Period pamphlet, which answered frequently asked questions around menstrual health and the different products that we had on offer, analgesics in the form of paracetamol or ibuprofen, and other sessions such as menstrual health sessions that were done in public spaces that included both young men and women. Specifically, the aim of the menstrual health study was to investigate the uptake, acceptability, and effectiveness of intervention. We wanted to understand existing knowledge levels, perceptions, and practices around menstrual health amongst young women, and then to co-design and pilot a menstrual health intervention within Chiedza. Looking at menstrual product choice, we wanted to understand informed menstrual product choice, and if there was continued or discontinued use of the product over time. We also wanted to understand the patterns of use. Were women using more than one product at the time? Was there a certain product that women chose to use on a heavy day versus a light day? We wanted to investigate the effect of the intervention on knowledge, perceptions, and practices. And lastly, to look at the acceptability of the intervention from the perspective of the participants, but also the Chiedza intervention team that was implementing the intervention. Using qualitative methods such as focus group discussions and in-depth interviews with our participants as well as our providers, and quantitative methods such as the analysis of pre-post questionnaire data, period tracking data, as well as service uptake data, we were able to find the following. Overall, there's a huge unmet need for menstrual health products, pain medication, and general information and support. We found that having an intervention that provided information and support that invited young women to talk about different products and to be able to come back when they needed further advice on how to use those products, and providing pain medication as well as products to choose, improved menstrual health knowledge, perceptions, and practices over time. We also found that it was extremely important to not only address the menstrual health needs of the participants we were working with, but as far as possible also work on destigmatizing menstrual health and breaking taboos within the community as well. Community engagement seemed to be key to any sustainable and meaningful change when it came to practices and experiences. For example, a participant could come to our service, be willing to try out something as new and novel in the community as a menstrual cup, but once they left our service, they would be met with a lot of stigma around using unsuitable products, and we had many of our participants having to bring back their product because it was not approved by someone older in their community or at home. We also found that the menstrual health service was a really, really effective way of engaging with young women. And so when we're looking at interventions that integrated sexual reproductive health interventions, using menstrual health as a pull or as a hook to bring in young women, something that should be considered. So what does this mean more? Addressing young women's health needs to use an integrated approach that includes menstrual health within SRH service provision. And when doing so, it is important that that menstrual health intervention is multi-component. Where possible, it should include choice, and it is very important that it addresses pain as well. And lastly, destigmatizing menstrual health and shifting social norms takes time and also requires community buy-in. Now we're going to hear from No Matter, who was one of our providers as part of the Chiedza team.
Hello, my name is Nometa Shamiarina. I'm 27 years old. I worked in Chiedza for 4 years as a service provider, and menstrual health intervention was really an important part of the Chiedza study. What I liked the most was the acceptance and appreciation from our local communities, from the products we were giving, the information, And most importantly for me as a service provider was the introduction of pain relief medication. I think this was mainly because I got to interact more with the girls and understood the pain they go through. Most of them will end up not going to school, going to work because of the pain, but having to engage with them and coming up with solutions and actually giving them medication made me very happy, because we have a lot of them coming back to us with important feedback that their lives are changing for the better because of this intervention. Thank you. Hello, my name is Nometa.
Thank you so much for taking the time to listen to the work that we've been doing in Zimbabwe. If you'd like to see any of the video content we've generated from the study and any of our publications with regards to menstrual health and other aspects of the Chiedza study, please do look at our website or use the scan provided on the screen now. Thank you.
Thank you so much, Dr. Mandy and Ms. Nomata. That was really insightful and really evidence-based, being on the field to see what adolescent girls really want and how they actually interact with some of the products and services that exist. We will be having another presentation from Dr. Jane, who is an assistant professor focusing on disability at the London School of Hygiene and Tropical Medicine. She's currently leading research to strengthen evidence about how climate hazards affect mental health and well-being of people with disabilities through risks to water, hygiene, sanitation, and co-develop principles for climate resilient, inclusive wash interventions in Bangladesh. She will be talking to us, doing a presentation about menstrual health of persons with disabilities and strategies to improve mental health for young people with intellectual disabilities in humanitarian emergencies. Over to you, Dr. Jane.
Hello, my presentation is called Improving Menstrual Health for Adolescents and Disabilities During Humanitarian Emergencies. So 1 in 6 people globally have a disability, and 80% of those people live in low middle income countries where there is a lack of access to water and sanitation and health and hygiene services. A vast majority of these people with disabilities will have invisible disabilities. So this might be visual impairment, hearing loss, cognitive impairment such as autism or Asperger's syndrome. But many menstrual health interventions that focus on disability inclusion only consider improving the accessibility of water and sanitation infrastructure for people with physical disabilities. Now that is very important, but it's not the complete picture of menstrual health interventions. About 119 million adults with disabilities rely on caregivers. And this is really important because some caregivers need guidance to understand how to support another person to achieve menstrual health. The photo on the slide is of children and a woman in a wheelchair surrounding a tap, and they're washing their hands with soap and water. Adolescents with disabilities face additional challenges to achieving menstrual health. In Egypt, people with disabilities were 20% less likely to know about menstruation at menarche than people without disabilities. In Vanuatu, people with disabilities are nearly twice as likely to miss out on social activities and 3 times more likely to eat on their own than those without disabilities during menstruation. And challenges intensify for those who are reliant on caregivers for their menstrual health. Many of these individuals with disabilities have intellectual and/or physical disabilities. And many caregivers have no support or guidance about how to support another person's menstrual health. And because of disability and menstrual stigma, which includes a lack of appropriate menstrual materials, caregivers can resort to physically restraining people, isolating them, and even sterilization. There's a growing recognition that menstrual health is a fundamental part of humanitarian responses, yet people with disabilities, especially those with intellectual disabilities, are inadequately considered in delivering such efforts. So moving on to the study that I've been working on, which is in Vanuatu. Vanuatu is an island state in the Western Pacific, and it regularly experiences natural disasters. So for example, in March this year, Vanuatu was hit by twin cyclones and a 6.5 magnitude earthquake within days of each other. So World Vision Vanuatu and I developed the Ve Vanua campaign. Now it's a menstrual health intervention for people with intellectual disabilities and their caregivers for the emergency setting in Vanuatu. It aims to support people with intellectual disabilities and their caregivers to understand what menstruation is, how to manage it, and how to prepare for menstruation during emergencies. And the campaign was delivered to 30 women and girls with disabilities and 35 of their caregivers. And the intervention includes a Ve Vanua doll that people with disabilities can practice changing and disposing of the menstrual material. We also developed a visual story, and some of the images from that story are included on the slide. So on the left is an image of Ve Vanua's dad helping her prepare for a cyclone by packing her menstrual materials into the yellow storage bag. The next picture is of them, the family evacuating, and Ve Vanua is carrying her menstrual storage bag during the cyclone. Her mum is then showing her how to place a menstrual material in her underwear, and then explaining that menstruation is a normal part of growing up. And then finally, the image on the right is of Ve Vanua's mum and dad reminding her where to get menstrual materials and clean underwear. We included men in the campaign and in the visuals because we wanted to include communication across the family about menstrual health. So we evaluated the campaign and found that adolescents understood the training and applied their learning. These two images are self-directed portraits of two adolescents with intellectual disabilities who took part in the campaign. The photo on the left is owned by Josephine, that's a pseudonym, and the caption is Dolly and Book. So in the photo, she's looking at the visual story and holding the Ve Vanua doll. The next photo is a self-directed portrait by Phelan, and the caption is filling up my bag with calico, which are menstrual materials. This is another self-directed portrait by Josephine, and the caption is I'm going to a house to hide in case the cyclone comes. So you can see that Josephine is carrying her menstrual storage bag with her for an evacuation. And caregivers also reported being better able to support the person's menstrual health and being better prepared for the next emergency. And humanitarian actors wanted to scale up the campaign. So in summary, the Ve Vanua campaign worked in the Vanuatu context, but now it needs to be adapted, piloted, and evaluated in other settings. Here are some references from my presentation. Thank you for listening.
Thank you so much, Dr. Jane, for such a wonderful presentation. We have come to the end of our session. A poll will be across the screen to ask the very questions again to see if we still have the same mind about menstrual health being a priority to adolescent health and well-being. We could not answer all questions. We would send across a report after the session to answer all your questions. Thank you so much. And can all the speakers just say bye to the speakers? Thank you so much for coming. Thank you.
Thank you.